Hey everyone, welcome back to the deep dive. We're going to be getting into some really key stuff today, nutrition for nursing.
Yeah, it's really important, especially for those of you getting ready to take your LPN exams.
That's exactly right. It's a huge part of basic nursing care. And we want to give you a solid foundation. We're not going to get too bogged down in the super technical stuff, but we do want to make sure you're comfortable with the core concepts.
As a roll.
We've gone through a bunch of material that's specifically geared toward LPNs and what they need to know about nutrition.
It's kind of a streamlined approach, just the essentials.
Totally. So we're going to cover how to assess a client's nutritional needs, what kinds of risk factors can impact their nutrition, and what nurses can do to help.
So jumping right in here, one of the things that really struck me is the role of nurses in nutrition. It's so much bigger than just making sure the patient gets their food tray right.
Right. And it's more than just, handing out dietary pamphlets, too. Nurses are really involved in all aspects of nutrition care, from assessments to interventions to education. They're really kind of like the quarterbacks of the nutrition team.
That's a great analogy.
The material really emphasizes how nurses work with clients with all sorts of nutritional needs, not just the obvious stuff. Whether it's someone with a chronic illness like diabetes or a patient recovering from surgery.
Absolutely. And they're constantly monitoring the client's status, catching any potential problems early on, and then making sure the right people are involved.
Yeah, like working with doctors and dietitians to adjust care plans as needed.
And don't forget the family piece.
Oh, right. That's so important.
You can't really get a complete picture of a client's nutritional habits without understanding their family dynamics and their home life. What kind of foods do they usually eat? Who cooks in the household? Are there any cultural or religious dietary practices that we need to be aware of?
Totally. It's all part of providing truly individualized care. Now, the sources also made a big point about the Joint Commission's requirements for nutrition screening.
Huge point.
Yes. They actually mandate that every patient admitted to the hospital needs a nutrition screening within 24 hours. That tells you just how seriously this is taken.
And nurses are the ones who typically do those initial screenings, right? They're often the first to spot any potential red flags.
Exactly. So you need to know what to look for, what questions to ask, and how to interpret the findings. And if you find anything concerning, then you'd make a referral to a registered dietitian for a more in-depth assessment.
Exactly. So the nurse's role is really like that vital link in the chain. And it's not just about identifying potential problems either. Nurses are also super involved in monitoring and evaluating how well the nutritional interventions are working.
That's a great point. Like, if a patient's on a special diet, the nurse is the one who's seeing if they're actually eating the food, if they're tolerating it okay, and if it's having the desired effect. Okay, I want to touch on something that I think a lot of people might assume. That if a client looks healthy, then their nutrition must be fine.
Right. But that's definitely not always the case, is it?
Nope, not at all. Appearances can be deceiving. Someone might look like they're at a healthy weight, but they could still be missing out on essential nutrients.
It's a good reminder to really delve deeper and not just rely on visual cues.
Definitely. And the sources specifically mentioned that you can't just apply a cookie-cutter approach to everyone. You really have to take into account cultural norms, social factors, and each individual's unique situation.
What's considered normal in one culture might be totally different in another, like portion sizes, meal frequency, types of foods. It all varies. And then you have to think about the individual's personal preferences and their lifestyle, too.
Yeah, even if someone knows a lot about healthy eating, they still might not always make the best choices. Maybe they have a really demanding job that makes it hard to eat regular meals. Or they might have food sensitivities or allergies, or they just really love certain foods that aren't so healthy. But what's interesting is that the materials really stress that just lecturing people about what they should and shouldn't eat isn't usually very effective.
No, not at all.
It really comes down to understanding where the client's coming from and working with them to make realistic and sustainable changes.
Exactly. It's a partnership, not a dictatorship.
So we've talked about the role of nurses and why it's important to look beyond just appearances. Now, let's dig into the actual tools and methods used for nutritional assessment.
The first thing we need to understand is what's called a diet history.
Okay. What exactly is a diet history?
It's basically a detailed interview where you ask the client about their typical eating and drinking habits. We want to know what they usually eat and drink, when they eat and drink it, and how much. It's more than just, what did you have for breakfast today?
Right, you're trying to get a bigger picture.
Exactly. So you ask about their breakfast, lunch, dinner, and any snacks they typically have. Are they grabbing a bag of chips every afternoon? Are they skipping meals altogether? We need to know.
That makes sense. What about drinks?
Same thing. We want to know what kinds of fluids they drink, how much, and when. Are they drinking enough water? Are they guzzling sugary sodas all day? Are they big coffee drinkers?
I guess that caffeine intake could be important too, right?
Definitely. Especially for certain medical conditions.
So we've got meals, snacks, and drinks. What else is included in a diet history?
Well, there are a few other things, like how the food is prepared. Do they fry everything? Do they use a lot of salt? Do they eat a lot of processed foods? And then we need to know about any special foods or dietary practices, like maybe they only eat kosher foods, or they're vegetarian, or maybe they have a big family feast every Sunday where they go all out. It's important to know about those things because they can significantly affect their overall calorie and nutrient intake.
And what if someone's trying to follow a specific diet, like a low-sodium diet or a diabetic diet?
We definitely want to document that too.
Yep.
And if they're on any special diet, we need to know how well they're sticking to it. Are they finding it easy to follow? Are they struggling with cravings?
That's a good point, because if it's not realistic for them, it's not going to work. What about food allergies or dislikes?
Oh, it's really important to ask about too. We don't want to suggest a food they can't or won't eat.
Right, because then they're just not going to eat it. And then you also ask about any medications or supplements they're taking.
Absolutely. Some medications can interact with certain foods or affect appetite, so it's crucial to know about those. And supplements can contribute to a person's overall nutrient intake.
Okay, and I think the last thing was about how satisfied they are with their diet, right?
Yep. We asked them to think back over a certain period, like the past 3 months or a year, and tell us how happy they are with their eating habits. It gives us a sense of their overall relationship with food.
Okay, so that's the diet history. It's pretty comprehensive, huh?
It is. It's really the foundation of the nutritional assessment.
So what comes next?
Well, after we've gotten a good understanding of their usual eating habits, we move on to the physical assessment. We look for any signs that might suggest nutritional deficiencies.
So what kinds of things would you be looking for?
We look at their hair, skin, nails, eyes, mouth. Basically anything that might give us clues about their nutritional status. For example, if their hair is really dry and brittle, that could be a sign of protein deficiency.
Makes sense.
Or if their skin is very pale and dry, that could indicate iron deficiency anemia. And then we look for signs of muscle wasting or loss of subcutaneous fat, which can happen with severe malnutrition.
Those are pretty dramatic signs, though.
They are. But it's important to remember that subtle signs can sometimes be just as important, like slow wound healing or frequent infections can also be related to poor nutrition.
And I guess you'd also be checking their vital signs, right?
Absolutely. Things like blood pressure, heart rate, and temperature can give us additional information about their overall health, which can be tied to nutrition.
Right. So we've talked about the diet history and the physical assessment.
And then we come to the anthropometric measurements.
Okay, what are those?
These are basically measurements of the body. The most basic ones are height and weight. Those are used to calculate something called body mass index, or BMI.
Ah, BMI. Most people have heard of that one.
Right. It gives us a general idea of whether someone's weight is healthy for their height. But it's just a screening tool. It's not a perfect measure.
Yeah, you can't just rely on BMI alone. Like, a bodybuilder might have a high BMI because of all their muscle mass, but they're not actually overweight.
Exactly. It's just one piece of the puzzle. So with weight, we always want to make sure we're measuring it consistently. The same time of day, wearing similar clothes.
Why is that so important?
Because weight can fluctuate throughout the day, depending on things like how much fluid they've had or what they've eaten. So if we want to track their weight over time, we need to make sure we're comparing apples to apples. And then we can calculate the percentage of weight change, which can be a really useful indicator of nutritional status, especially in people who are at risk for malnutrition.
Like someone who's been sick for a long time or who's recovering from major surgery.
Exactly. And we can also use something called the Hamley method to estimate what their ideal body weight should be based on their height and gender. But again, that's just an estimate, not a hard and fast rule.
Okay, so we've got weight, BMI, and the Hamley method. What about height? Are there any special considerations for measuring that?
The main thing is to make sure they're standing up straight, without shoes, against a flat surface. And their head should be level. And for babies and young children, you'd measure their length lying down.
Got it. Okay, so after we've done all the physical measurements, are there any lab tests that can give us more information about a client's nutritional status?
Yep, there are a few key ones. One is called prealbumin. It's a protein in the blood that can tell us how well someone is absorbing and utilizing protein from their diet.
So if someone's prealbumin level is low, that means they might not be getting enough protein.
Exactly. And it can be a particularly useful marker for people who are critically ill or who are at high risk for malnutrition. It's more sensitive to short-term changes in protein status than some other tests.
Okay, so prealbumin is a good one to know. What about the nitrogen balance?
Nitrogen balance is another important indicator of protein status. It basically compares how much protein someone is taking in with how much they're breaking down and excreting.
So how do you figure that out?
You can estimate it by looking at their protein intake and their urine output. A positive nitrogen balance means they're taking in more protein than they're breaking down, which is a good thing. It usually means they're building and repairing tissues. A negative nitrogen balance means they're breaking down more protein than they're taking in, which can happen with things like illness, injury, or starvation.
That makes sense. So a positive nitrogen balance is what we want to see, right?
Yep, especially for people who are recovering from surgery or who have wounds that need to heal. And then there's albumin, which is another protein in the blood that's often used to assess nutritional status.
So if someone's albumin level is low, that means they're not getting enough protein.
Well, it can be a sign of protein deficiency, but it's important to remember that albumin levels can be affected by other things besides nutrition, like liver disease or kidney disease. So we have to look at the whole picture.
Okay, got it. And the last one was fluid intake and output, right?
Yep. We always want to make sure our clients are well hydrated, but we also want to watch out for signs of fluid overload, which can happen with certain medical conditions. So we carefully track how much fluid they take in and how much they put out.
Okay, we've talked about how to assess a client's nutritional status. Now let's get into the risk factors for inadequate nutrition.
The material breaks it down into three main categories: biophysical factors, psychological factors, and social determinants of health.
All right, so biophysical factors, what are those?
These are things related to the body's physical condition. Like certain medical conditions can affect how well someone absorbs and uses nutrients. Conditions like Crohn's disease, celiac disease, or cystic fibrosis. And some medications can have side effects that affect appetite or nutrient absorption.
And then there's age, right?
Oh yeah, age is a big one. Babies and older adults have different nutritional needs than adults.
Okay, so that's biophysical. What about psychological factors?
These are things related to a person's mental and emotional state. Like depression or anxiety can lead to changes in appetite. And some people use food as a coping mechanism for stress or boredom. And then there's body image issues, which can lead to disordered eating.
Right, so all those things can really affect someone's relationship with food.
Absolutely. And then the third category is social determinants of health.
Okay, what are those?
These are the conditions and the places where people live, learn, work, and play that can affect their health. Things like poverty, food insecurity, lack of access to health care, and even things like neighborhood safety and transportation can all have an impact on nutrition.
Wow, I never thought about how something like neighborhood safety could affect what people eat.
Oh yeah, it can definitely play a role. Like if someone doesn't feel safe walking to the grocery store at night, they might be more likely to rely on fast food or convenience stores, which often don't have the healthiest options. And if someone lives in a food desert where there are no grocery stores nearby, it can be really hard to get fresh fruits and vegetables.
So these social determinants can really create a lot of barriers to healthy eating.
They really can.
Okay, the sources gave some specific examples of how these different risk factors can play out in real life.
One example was a client with edema who's put on diuretics and a low-sodium diet. So they may need potassium supplements because of the diuretics and may have a hard time sticking to the low-sodium diet.
That's a good example of how medical treatment can affect nutrition, right?
It is. And another example was someone who's concerned about osteoporosis. They might start eating more calcium-rich foods and taking vitamin D supplements. And they might also start doing weight-bearing exercises, which can help to build bone density.
So that's an example of how lifestyle choices can have a positive impact on nutrition.
Exactly. And then there was an example of someone with a poor self-image who might develop unhealthy eating habits. They might restrict their calories severely, or they might binge eat as a way of coping with their emotions.
So it's all interconnected, really.
It really is.
Okay, so we know how to assess nutritional status, And we know what some of the risk factors are. Now, let's talk about what nurses can actually do to help improve a client's nutrition.
Well, the first thing is to really listen to the client and understand their individual needs and concerns. It's not just about giving them a meal plan and telling them to follow it.
Right, because if they don't buy into it, it's not going to work.
Exactly. So you might need to help them problem solve any barriers they're facing, like lack of time or money. And you can also provide education and support to help them make healthy choices.
So it's really about empowering the client to take charge of their own health.
That's the goal. And nurses can also advocate for their clients. Like if a client needs a referral to a dietitian, or if they're not getting the right kind of food in the hospital, the nurse can speak up on their behalf.
That's a great point. It's really about going above and beyond just the basic tasks.
Exactly. And I think that's what makes nursing so rewarding. You really get to make a difference in people's lives.
So let's tie this all back to the LPN exam.
All of this is super relevant for your LPN exam. You need to know this stuff inside and out.
It's not just about memorizing facts and figures.
No.
Yeah.
It's about applying the knowledge in real-world scenarios.
Exactly. You need to be able to think critically and use your judgment to make the best decisions for your clients. So as you're studying, don't just focus on the definitions. Really try to understand the concepts and how they apply to real-life nursing practice.
They often give you case studies on the exam where you have to figure out what's going on with the patient and what the best course of action would be. So it's important to be able to connect the dots. Like if you have a patient who's lost a significant amount of weight, you need to know how to calculate their percentage weight loss and what that might indicate.
And you need to be able to recognize the signs and symptoms of malnutrition and know what interventions to implement.
Exactly. And you also need to be aware of the different risk factors, both biophysical and psychosocial.
And don't forget about the social determinants of health. Those are really important too.
Yep, they can have a huge impact on a person's overall health and well-being. So you need to be able to identify them and take them into consideration when you're planning care.
Okay, so we've covered a ton of ground here today.
We have.
But I think it's been really valuable.
Definitely.
We've talked about the role of nurses in nutrition, how to assess nutritional status, the risk factors for inadequate nutrition, and what nurses can do to help.
It's a lot to take in, but it's all really important stuff.
So here's a final thought for you as you continue studying for your LPN exam. Think about all the different factors that can impact a client's nutritional status, from their individual habits and preferences to those broader social determinants of health that we discussed. And then ask yourself, what do you think is going to be the most challenging aspect of addressing nutrition in your future role as an LPN? And how do you plan to approach that challenge? It's something to really think about as you move forward in your nursing career.
I think that's a great question.
All right. Thanks for joining us for the deep dive. We'll see you next time.
Bye, everyone.